Hey everybody, my name's Joe. In regards to my shoulder surgery, the rotator cuff surgery, bicep tendon surgery, today what I was going to show you is, this was it. This was my chair, especially the first 24 hours of what I could get comfortable in. Sit back a ways, and then I could put my head up against the back. I was able to throw a blanket over me. And then this was my manageable position. There's not a lot of movement I can do here, but it kind of rests up against the arm here, the arm rest, and my elbow kind of rested up against that. That was okay. And then this was my position. And the good thing is, if I needed to get up, I can grab a hold of this arm, push myself forward, and then I can go to stand up and move around. Now, the other side was, this was the best chair for me when I was trying to do icing on my shoulder. So I would take my bag and I'm going to throw that over my shoulder. So this is that 3 to 4 pound bag. I'd sit here up against the chair, but now I'm more at an angle. I've got my right shoulder into the padding of the back of the chair, and then I could put my head up against the back of it along with this towel. This towel was very soft on my face. It was comfortable. So for me, this was my luxury when I was trying to, distract yourself from the pain, having ice on my shoulder. I've got my cell phone handy. If my fingers started getting really cold, I had my little snow gloves nearby. I could put those on. I've got a beanie on, but I had my other beanie ready to get on because, the ice is cold, and if my body went through that cold phase, I'd have to stop this, bundle up, and then put the blanket over me. But generally, I can be in here for maybe 10-15 minutes. It gives me a little cooling effect, and then when I need to get out, I can either grab a hold here, use my elbow against the back end, push myself forward, get my feet set, hold on here. I've got a number of options that I can hold on to get myself in an upright position before I'm going to stand up and use the bathroom or whatever. This is just my regular sturdy chair. The reclining chair I wasn't able to use the first night, but by I think it was the second night and the third, I could certainly use the reclining chair, and then I could sit back, but sit back at like a 30 to 45 degree angle. I couldn't go all the way back. That was too painful. It just did not feel good, but I've been able to use that, try to get some sleep in that, and then, like I said, throw the blanket over me. So I just wanted to give a quick heads up on that. Welcome to the world of recovery from an injury and how life changes. Do I wish I could lay face down or on my back in a bed and curl up with a pillow? Oh, absolutely, but for right now, that's just not happening. So the little things in life you can miss, but you try to make it as comfortable as possible or as manageable as possible. And if you've got someone who can help you, great. But if you're alone, this is something you can work on. All right, thanks for tuning in. That was just a quick little piece. See you.